Hello, hi, welcome back everyone. So we start the post-T session now with Samit Bhattacharyya, who is a professor of mathematics at Shivnadar University. He works on malaria, broadly speaking, epidemiology, right? And he started off with his mathematical biology career right from his PhD days at University of Calcutta. Did a few postdoc stints in various parts of Canada before moving to Shivnadar. Over to you, Shamit.
Yeah. Okay. Thank you. Thank you very much. So, good afternoon, everyone. So, I first thank organizers Sagar and also Supratim, the I say all. Thank you very much for giving me opportunity to, for first of all, organizing such kind of interesting school and inviting me here to talk about some of my research in my lab. So I'll talk about malaria eliminations. Malaria, I think, more or less everybody knows this thing, and I'll talk about the elimination process, especially in sub-Saharan Africa, and we'll look at it from evolutionary game perspective. So malaria actually brings a lot of toll or huge toll on, including deaths worldwide, and 90%, more than 90% on sub-Saharan Africa. So the question that we are asking in my research is that why, despite decades of intervention that people are putting effort, especially public health, on controlling malaria worldwide, then why it remains so elusive, this elimination process? That is kind of the question that we're asking. One apparently may think that probably keeping the supply chain of bed nets or medicine treatment, if it remains kind of the alive to the vulnerable population in those countries, will do the job, but it is not. In fact, a lot of individual choice, human behavior, economy, and several other things, including environment and climate change, that actually interacting, to make a success for this elimination process. So in this talk, I will explore this elimination process, or kind of the dynamics here, through the lens of this evolutionary game perspective, and with some few basic statistics of malaria in those, especially in sub-Saharan Africa. I'll talk about our model and some key findings and some policy-oriented aspects. So, so malaria, I'm sure everybody knows this. So it is a vector-borne disease, and of course, there is a more complicated biological life cycle is there. We do not need to go into that. At least in the population level, we need to understand that it actually spreads through human and mosquito interactions, and mosquito get infected when it bites infected human, and when it takes this blood meal, that virus is transferred through the blood to the mosquito, mosquito get infected, and when it bites to another healthy individual, and that it spread the infection to that healthy population. That is how it spread in the community. So that is what it is. Now here, if you see, that is the scenario, worldwide scenario in 2002, where you see there are various places where malaria was eliminated, but it was mostly concentrated in sub-Saharan Africa, India, some of the region in Brazil, Colombia, and also in part of this China and things. So here, this is the scenario. Is this? Now, this is the scenario in 2022, where you see the malaria is mostly concentrated on sub-Saharan African region countries, and globally, it is estimated that 250 million malaria cases, in 2022, in this WHO African region, and sorry, this is in the worldwide, and 94% of that thing is accounted for this WHO region. So still today, this high malaria transmission is concentrated in most of these countries here. And this is about the death. As you see here in 2023, the 95% of that global malaria deaths are from the sub-Saharan African region here. And moreover, 76% of these deaths were among the children under 5 years old. So that is the current scenario of malaria here. Okay, so that is why this is in World Health Assembly. WHO designed some global technical strategy which talks about different issues. For example, reduce malaria mortality rates, reduce malaria cases, and eliminating malaria from countries in which malaria was transmitted in 2015. So based on this, so the milestone was that based on 2015 scenario, like they kind of the strategy's goal was at least 40% of the case that need to be reduced by 2020, 75% in 2025, and 90% approximately in 2030. So that was the vision and the goal of this malaria. So if we illustrate more, so here is this. So if you see from ideal cases, the black one is, so this is the 2015 scenario, these particles, but here is 2020, this red dots is the kind of a threshold where black is going this thing, but the violet one is going above this. It means it fails to catch the milestone. In 2025, green fails, the black one still attains this thing, and here again the black one is achieving these 2030 goals, but the blue one fails that. So that is the kind of scenario that we expected in or they assign this date like GTS. Now, so, but this is the kind of outcome in 2020 scenario, GTS milestone. As you see here, I'm talking about sub-Saharan African countries. Only 4 countries out of say 40 countries actually were achievers. They are on-track countries. They achieve to reduce by 2020 this 40%. But others at different level of achievement, like for example, decreasing 25 to 40, less than 25, no increase, even more than 25, increase. So why this is scenario? So one of the recommendation from the WHO was like we have to increase vector population, because the two measures basically work for malaria. One is increase the ITN use, that is insecticide treated bed net, that we have to use, that we have to increase the uses of that thing. And second one is that spraying the pesticide. So one of this thing that we are considering here to understand the ITN uses in the community, especially in SSA countries. So as you see here is that insecticide treated bed net, it has been proven that it's very effective and cost efficient method for reducing malaria transmission. The one thing is that this treated bed net, it not only protects from the bites, but it also kills the mosquito, and that is the interesting thing. So if many people are using in the community insecticide treated nets, it reduces the the mosquito density. So there is a kind of a community impact or effect of that thing, and that creates some kind of interesting strategic decision making at the individual level. Like when there is kind of very little mosquito here and there, then people trying to use that kind of the thing here. So here is basically the thing comes over here, and what you see here, there's a lot of misuse of ITNs, and they repurpose for fencing, fishing, gardening, and so many things. And as you see here, there's one data published there. So from 2005, this is LNN, long-lasting insecticide-treated bed nets, and before that, it was insecticide-treated bed nets. So as it increases from 2005, this kind of distribution, not the coverage, distribution, at the same time in the West as well as in the East Africa, the mosquito net fishing is also increasing. That is more or this misuse is also increasing. That is what the thing here.
How long does this effectiveness of mosquito killing is with the
Well, in general, they say it is a 3 years, but it depends on how many times they're washing it. So there are a lot of kind of debate on that thing. So we have also using with 3 years. I'll show you in the model. Okay. So here is kind of recent scenario of ITN uses. This uses is basically proper use, who are sleeping under the bed net, and which you see that in most of the countries in sub-Saharan Africa is like 40 to 50%, not more than that thing. So this, in fact, some inconsistent item uses jeopardize the malaria elimination effort in SSA countries here. So oh, that is what I'm going to discuss here. Yeah, okay. There are several kind of behavioral interaction issues. One is like sociological, this lack of social awareness. That is one thing, because they're very remote. There are a lot of conflict in political as well as, issues there. For malaria control program, they don't get a lot of information on this thing. There are epidemiological issues like bed net efficacy, that's what you're talking about. There is a high transmission in some of this region because of their temperature and environmental issues. And of course, another important issue is the poverty. This is economic. In fact, one data shows that, when we map this malaria prevalence with the GDP, as you see here, that most of the sub-Saharan African countries are putting here inside this red globe. That is, they have less than 1,000 GDP and region they're kind of researching. That makes very difficult for them, to make the decision whether I should go for proper use or I should go for improper use when there is less mosquito there. So that is an interesting thing, and we worked with there. So we are trying to understand with this model. So here is this model, malaria transmission model. So let's not go into the details of this equation, but what you see is the blue basically describes the human population like compartmental model. This one is the mosquito population here, and here is the biting rate. So proper use of bed net actually impact this transmission of malaria here. And it has, like, if you see, is that this is the efficacy, this B beta T, which is actually decays in 3 years, and after that they replace the net, so with high efficacy again it start kind of decreasing. There's a lot of debate on that thing, and based on that the transmission actually, when there's a high efficacy, then transmission is low, but when the efficacy declines, then transmission impact is start increasing. The thing is, we also consider on the mosquito mortality rate. As I told you, this is not simply bed net, it is insecticide treated bed net. So there is also kind of impact on the mosquito mortality. So with this model, we have also we have developed some kind of a game theoretic interactions using evolutionary the model here. What you see here, the players are basically healthy individuals because they have the most kind of incentive for using it or not. Okay, and they have two strategies, whether you go for proper use and for improper use. And as you see, XH, these are the proportion of the population that who adopt the proper using for this thing, and 1 minus XH use the ITNs for improper using. So here is the payoff function is the risk from improper use that you can catch infection. There's a probability, okay? And that depends on the number of infected, also like getting mosquito bite, which depends on the total mosquito population in the population here, and also depends on the efficacy here. And loss of due to proper use. So if you are not using for your fencing and all the other things, you will lose your productivity. So here is this thing, loss from the proper use. So using this pair of functions, so we can also use some sampling and imitation, like what my neighbors are doing. So if I see that neighbors are doing some strategy, and if it has some kind of gain in the payoff, then one can also switch with some probability to the payoff gain. And that brings to the equations of this proper use of bed nets. So XH is the proportion of population who are using this bed nets properly, and it depends on this according to this equation using this kind of payoff gain functions. So using this, what we see here is that this model, when you couple with this epidemiological model, then it gives interesting dynamics. Of course, when we have everybody is using mandatory kind of use, then there is a very less see this yellow curve is the this cumulative this infected population. But when there is nobody using, there's a very endemic situation of the disease. But when you use behavior with and without replacement, that brings some kind of a oscillation here. And here is kind of the diagram which shows that this zero, there's a high population cumulative incidence, but when everybody is using, in contrast, so almost not there. But when we use behavior thing like voluntary involvement, then you see there's an impact on this thing. The interesting results of this kind of qualitative aspects that we're looking at is that this one, when you see the efficacy, when you use no game theory model there for malaria, people have already predicted that when you increase efficacy, that will reduce the mosquito population and that will eliminate malaria. But this is not the scenario. In fact, when there's a efficacy near 1, when you say that there is again the high cumulative incidence, and that actually indicates the free riding kind of behavioral interaction in the population. So there should be some kind of a middle optimal, middle value of efficacy will be the optimal. Of course, it depends on other type of parameter regime, but definitely high efficacy is not always beneficial. So these are the qualitative behavior. But what we wanted to look at is how we can explain the failure of those countries in the GTS, Global Technical Strategy. That was the main thing of our kind of aim in this work. If you notice properly, there are 3 parameters here in this entire model or the coupled model. One is the kappa. Kappa is basically the imitation rate, like individual, when they get to know about, like, the campaign, from other kind of information, and they try to imitate the better strategy. That is in kind of signify the social awareness in their thing. R is basically relative, the profit, which depends on, which gives a proxy for these economic subsidies. Like if government gives more economic subsidies, then probably they will not going to use the mosquito bed net for other fencing and kind of thing. And third thing is the efficacy, that is of the ITN. So these 3 parameters that actually public health can authorities can take into that, and they can modify, and they can put their strategy based on this thing. So we try to classify this GTS 2025 and 2030 targets for all 38 countries. We have more than, I think, 42 countries or something like that, but some data are not available. So we have worked on 38 countries in sub-Saharan Africa with like malaria burden, as well as the bed net coverage. We have collected on that from my collaborator, and we try to estimate that why there is failure and what are the kind of incentive required to got the target for this 2025 and 2030. So here is kind of the workflow. So like what we have done is we have the data from different project here. So we have pre-estimation for 80 years. We have simulation we have done for this pre-estimation calibration for different kind of parameters. So we have trained the model according to the country's population, because 38 countries has different, different population, different socioeconomic status, different mosquito, the population, different, entire model, parameter setup is different from one country to another country. So that we have done this pre-estimation calibration. And after that, we have defined the entire thing in 3 phases, which is parameter estimation for 2000 to 2022, and then we have for prediction, we have done for this optimized projection for 2025 and 2030 milestones. And in optimized projections, we have tried to see what is the general cost for all these 3 things, because these are the 3 parameters, kappa, R, and beta, that is defining kind of campaigns, cost for campaigns, cost for economic subsidy, and cost to increase the efficacy of the bed net. That is the three costs that they have to government or the public health authority has to bear for this thing. So we try to minimize this thing and see if it is possible and what kind of measure we have to do for a specific country. So what we see here is that is kind of the strategic planning tree we have designed. For example, achievers and non-achievers. We have 4 country achievers, other 36 for 36 countries, 4 countries are non-achievers. So what is the kind of tree we have considered is that we have seen that whether same kind of social awareness and kind of economic stability will hold true for them, or we have to kind of improve that thing. If it is not, then do we need to increase the ITN efficacy for those population? So in that way, we have seen, or in the last option, it is not possible by doing all modifying all 3 kind of things. So this is kind of thing, and once they are achieved here, so we see again these 4 options here. So that is what we have considered, and what you see here is this. We have seen only 4 countries here, but done for all 32 countries. And as you see here is that this green one, basically the optimized projections, and here is basically the summary of that our results, which shows that for different countries, for example, Ethiopia and Mauritania, they no need to take extra effort to achieve basically for 2025 and 2030, compared to those countries, for example, here Kenya, Equatorial Guinea, they need to increase social awareness, and also they need economic assistance. But compared to, if you see here, Chad, Mozambique, they need to increase ITN efficacy. So it is population, socioeconomic based kind of prediction that we have done for 2025 and 2030. Now, we have also doing some kind of a clustering to countries, for example, based on mosquito biting rates, because of different country has a different temperature and weather pattern. So depending on that, they have different mosquito densities. That has been already, people have done that thing. And what is the relative cost basically for economic substance, because GDP for different countries in Sub-Saharan Africa is also very different, is very disproportionate here. And also here biting rate, the transmission. So we have, based on that, we have clustered, and we have clustered those countries, and which will help for policymakers to design targeted intervention and kind of thing. So this is one thing. And then next we have seen this, the rollback malaria. That is another kind of initiative, joint initiative by UNICEF and also WHO and UNDP development program, UN development program, where they've suggested to make it more effective, these elimination strategies, when they need more public-private engagement through intensive fund subsidies. And in that kind of strategy, they have proposed that we need more donor funding, in the beginning of this time. And what happens is that if over time that will decrease this thing, which not only donor funding helps to increase the ITN use in the population, but at the same time, it will develop the sustainable economy in that population. So eventually, what means is that there are 2 phases in those kind of the regime, when it's catch-up phase and keep-up phase. Catch-up phase is that, like, we have started with high donor funding, over time it will decrease, and then at the same time, this will help us to develop the economic growth. And after that, when they are in the stable position, it will actually help to ITN use. Then we do not need any external help, to keep the malaria elimination effort, sustained. So that is the kind of idea. And eventually, what does it mean that when we have a donor funding, then it will be an incentive for proper ITN use, and that will reduce the malaria. And if there is a low malaria prevalence in the population, that will help to grow their economy on their own. More individual will be able to do work, and they will make role in the production in the economy, and that will eventually, that will inhibit kind of the profit of improper use. People will go for more profitable use, and that will keep the cycle doing things. So we need donor funding. So in these problems, we are asking the questions that then what would be the country specific kind of the like what would be the initial funding. There are three parameters here which is very important: initial funding, and how, if we start from here, donor funding, at what rate it should be decreasing. Kind of, that's the second one. And third one is that how long we should continue this thing. So three parameters are very important. So to do that thing, what we have done is that we have modified this equation of proper bed net use. In fact, this funding, external funding, will be an incentive for individual, to proper bed net use. So that this utility function will change according to that. And what we have used or modify this function is that we have used this economic Cobb-Douglas function, which is say that this is labor-based and capital-based production, and that is here specifically for our model. Where, so if you see here that this is the healthy population basically in this community, and that they will have role. Yeah, I'll finish in 2 minutes. So they will have role in the production based on how many people are using properly in the bed net. So that is what we have done, and this is the economic growth equation. So this is basically a socio-economic epidemiological game theoretic model, where is this describe the disease transmission, this is economic part, and that is the behavioral part. We combine all three models, and what we have seen here, yes, these are some toy simulations, of course, because this work is still in progress. And what you see here, when you introduce economy here, like donor funding at t equal to 100, you see there is it actually helps to increase the I-10 use, and eventually there's a decrease in the disease in the cumulative the incidence, and of course this another thing, this production or the economy also increasing. So this model is working. So we have also seen that the initial donor, this high donor funding, initial donor funding always help, that will reduce, the cumulative incidence, and that will help to grow the economy faster here. But with this, we have also checked at what happens the optimal cost. For example, there are also disease in the community. So we have checked, this is the cost here. So this is for the treatment cost for this infected population, malaria, and this is the cost for the subsidy. And based on that, which one is more profitable from the public health point of view? For example, if tau and per capita cost of say associated treatment is way less than this subsidy, then we see that this initial donor funding, low initial donor funding is the optimal for reducing the burden here. In contrast, when you have tau2 is less than tau1, like for example, this is the per capita cost associated with funding is way more than your treatment cost, then this is the less. So these toy simulations actually shows that model is working. We are still in kind of progress, and we try to find out what is the country specific, three parameters, like how long, what initial donor funding we have to start, how long we have to give, and in which pattern, like decreasing rate, we have to implement this thing. So that is what we are kind of doing with the data from the different countries there. And so pretty much what I talked about. So malaria in SSA is is a complex interplay of epidemiological, economic, sociological, and behavioral factors. And game theoretic approach, helps to understand population level interaction, but definitely we need more macroeconomic impact models and cost-effective analysis and data integration, of course, to evaluate the long-term effects of malaria burden on productivity, education, and economic growth, analyze strategic interaction between policymakers, donors, and local governments in funding allocations. Okay, so with this, this is I should acknowledge my student Lakshmi. Actually, she actually worked the entire thing here, and some of my collaborators, Ina actually helped me to provide the data and some of this thing using analyzing and things. And of course, I should thank the grant from the DAD and DST. And with this, I should thank you all for listening to this. Yeah.
Could you just roll back to the simulations, please?
Yes. So, which one? This one?
This one, yeah. Are they all on the? Is this all the same run? Or no? Is this all the same run? Because you have the second one's number of infections, right?
Yeah, that is the dotted one is without this donor funding.
Right.
Here. So when you put donor funding, that your ITN is increasing, and as an impact, your malaria incidence is decreasing.
Absolutely.
Of course, yeah. But the thing is that, and you see, at the same time, the economy of the population is also increasing. But of course, this does not happen so fast. I understand that these are just toy simulations. We need to calibrate our model or train model according to the country-specific parameter regime that we have to do, and we are actually doing all these things now.
Okay, yeah, I was just a bit surprised by that big spike drop thing happening right at the start, but I'm guessing that's an artifact. Yeah.
Okay,
so okay, I'm not sure where we're going now. Okay, so. And the idea is that this growth leads to a higher use of the nets in themselves, right?
Yes.
Because the relative value of the alternatives decreases. Okay, it's all good. Thank you.
Yeah. Which one?
Is 2002, I think.
Oh.
You are showing the malaria in over the.
Okay. The first one, right? First slide, I believe.
Looks like the geography, the near vicinity of the equator has to be something.
Yes, of course. So that is what I.
What is the reason? I mean, far away from the equator.
Because that also depends on the transmission of the high transmission region, because of temperature actually regulates. People have already worked on that thing. They have integrated the mosquito life stage, this population growth depending on temperature and humidity. So near equator, there's a high temperature in the region, and that regulates the mosquito population.
More mosquitoes.
Yeah, that is, of course, definitely. But of course, in some places, when this is really top of the hill, there is a low mosquito population, but in the plain, there's a high. So that matters. So we have also incorporated in this model, cyclic kind of thing, like when there's a summer, there's a high mosquito, and after that, I mean, before the rain, other time, there's a low kind of thing. Of course, that is the one of the reason. We need to incorporate all these things, environmental impact.
Repeatedly saying that you're training your model, so you have used some neural network?
No, not neural network. So we have used some kind of a, say, for example, maximum likelihood approach or some kind of statistical approach, but not neural network with this thing. So yeah, I mean, like we are minimizing. So this is, say, for example, in very simplistic, it is least square approach or something like that.
So some regression you're
Yeah, of course, you can.
Okay, if I understand correctly, first part, it corresponds to some game theoretic, and secondly, there is some finite time optimal control problem which you're solving. So what are your optimal, the control inputs, the decision variables? If you can go to that objective function, the running cost.
Okay, so it's a little slow. I think, yeah. So next, this is.
Yeah, so what are your decision variable, your control inputs here?
So we have this model, right? For example, here is this model where you have like we have used this replicator equations. This is a behavioral this is equation here which involves this replicator equation, and that we have connected with your epidemiological model. Now using this model, subject to this model, we are optimizing this objective function. So we have three parameters here. It's the function of this efficacy as well as your social, this is the imitation rate and this relative cost. Because in three things are in the hand of public health, and they are trying to minimize the total cost, including this number of cases and loss due to it.
Okay, yeah, sure.
Yeah, we can definitely talk. I mean, I'll be here. So okay, yeah. Sorry.